Hello everyone, my name is Omar Al-Kamra. I'm one of the sports medicine doctors at OrthoVirginia in Lynchburg. We are the biggest orthopedic practice in the state of Virginia. We have offices in Northern Virginia, Central Virginia, Virginia Beach, and the western part of the state. That's where we're located. Today's topic is about concussions, so if you feel that this is useful for you or anyone you know, please feel free to share. Please refer to our website. This video will always be there, and please let's keep this as interactive as we can. You can submit questions, you can submit ideas, and we will tackle them at the end of the talk. So today's topic, like we said, is concussions. I'd like to start off by saying, what is a concussion? Almost all of us, or at least family members, friends, and people that we know have been exposed to a concussion. Concussions are a functional injury to the brain. What that means is that the brain can be affected from a functional perspective only. So that means that a CAT scan or an MRI would have to be normal. That's because this is considered to be a mild traumatic brain injury. Concussions are injuries that affect the brain and the brain function. So everything that the brain does can be affected. Symptoms range from headaches to dizziness to double vision to blurriness of vision. Sometimes they can affect sleep. People can sleep too much, too little, have difficulty falling asleep. Definitely affects mood. People can be nervous, people can be a little bit more anxious, a little bit more frustrated. At the same time, it does affect the function of the brain that we call the cognition, which is the ability to think, remember, focus, multitask. It's also important to remember that all of these symptoms can be present at the same time. Some of them may be present, and these symptoms can actually appear differently in different people and in different age groups. So a concussion is a functional injury to the head, which results from motion of the body or the head, and it can be associated with loss of consciousness, does not have to be associated with loss of consciousness, and included all those symptoms that we talked about. Everybody relates concussions to football, to hockey, to lacrosse, to soccer, and that's very, very true. We know for a fact that sports can lead to concussions, but we also know that 50% of concussions are not sports related. So the normal things we do around the house, some people can trip, fall, some people can hit their head on a cabinet, car accidents, bike accidents, all of those things can cause concussions. It's really important to understand what a concussion looks like so that we can actually recognize it. Just like we described initially, the symptoms are many. And when the symptoms are that many, it is very possible for us to confuse it with other things, or even sometimes go unnoticed. And it's very important to recognize how concussions present in different people in different times of their lives. When we have a football player who's a high school kid or possibly a college student and they get injured, there are so many people out there who can actually tell that the patient had a concussion, from coaches to athletic trainers to people in the stands. But that's not the same with people in their normal daily life. So to recognize a concussion, we usually like to recognize an injury of some sort. Someone fell, someone hit their head, and then that injury would probably be associated with some symptoms that we mentioned. The symptoms do not have to appear right away. Quite often the symptoms are delayed, and that does work well with the pathophysiology, which is the way or the mechanism by which a concussion manifests in the brain, because there is a delayed effect of this. It can be around 24 to 48 hours until the symptoms are at their maximum. Also, we have to keep in mind that a lot of people, if they get injured on vacation, for example, don't get the symptoms until they go back to school and they're challenged by schoolwork. So it's important to recognize the injury, and like we said initially, the injury does not have to include a direct injury to the head. It can just be shaking of the head. And also we have to have some symptoms. When we have that, we kind of start doubting that we have a concussion. Now, what do we do next? That's not a diagnosis. That's, mom and dad catching up on a child. That's a coworker seeing their friend, family members, that sort of thing. We can go to anywhere from primary care doctor to the ER to a concussion specialist. And to be quite honest, we are in such a better place today when it comes to concussion recognition than we were at least from my experience from 7 years ago when I started practicing. Our schools are much more in tune. Our coaches and athletic trainers have always been great at it, but now also our ERs, our primary care doctors, and everybody knows more about the topic. I would like to say that an ER visit is not essential for a concussion unless there are warning signs. What are the warning signs that take us to the emergency room? Well, definitely if there's anything else besides the concussion. A broken arm, any major injuries, that goes without any kind of doubt. However, if someone has just simply hit their head and they don't have loss of consciousness more than 5 minutes, loss of memory for more than 15 minutes, or any significant weakness in a limb, so my right arm is weaker than the left, my left leg is weaker than the right, or any seizures, then it's perfectly safe for us to just go to the primary care doctor or go to the pediatrician or come to see a sports medicine doctor. It's very important for us to recognize the concussion because early recognition will help us treat it appropriately. You're always safe by recognizing a concussion, removing the person from the situation of danger, whether it's a player who's playing a football or who's playing a sport like football or soccer. Taking them out, putting them on the sidelines is the first initial step. Taking them in to see their pediatrician will be a very good second step, so on and so forth. Now, diagnosing a concussion is not always easy. The doctor has to do certain examination inside the office. It's a full assessment of a neurologic system, some special concussion testing, and also, like we do here, we use computer testing. So we use computerized testing to evaluate the patient's condition when we see them, as we follow them up, and before we send them back to school. Not one of those things is enough by its own. We usually like to have all of those put together, plus significant input from the patient and their family members and their coaches as how well are the people doing or not. Once we recognize the concussion, once we diagnose it, we actually have to rest. We really have to rest as much as possible. 6-7 years ago, we actually used to tell the parents to take away the phones, take away the iPads, take away everything, and just let them rest and sleep. We figured out that that's not the best way to do it. We figured out that that creates significant anxiety because of the social isolation that the students have. So the rule of thumb started to become, if it's not bothering you by that much, it's okay to tolerate it. And we do short periods of time. We don't want to play video games until 2 in the morning. But 30 minutes of video games is reasonable, is okay. We don't want to go out to do a very aggressive workout, but if you want to go out and walk, even maybe just a very light jog, if the symptoms are minimal, that's acceptable. So we want to protect the athlete or the concussed human being, and we want to make sure that we allow them a certain amount of rest. Why is it important? Because we know in our younger population, so our athletes, we know for a fact that rest can actually help heal the concussion. So 90% of people under the age of 30 usually heal the concussion within the first 2 to 3 weeks of actually sustaining a concussion. 10% of people end up needing a little bit more work, a little bit more therapy, which we'll discuss later. Now, with my practice evolving and seeing more and more patients, I'm actually seeing more adults who are having significant concussion issues from non-sports related injuries. So those include like work injuries, car accidents, falls from height, and all that. That's a completely different ball game. That takes a little bit longer and takes a lot more work to actually get back to where we need to be. But when it comes to our kids, when it comes to our athletes who are young, healthy, and active, usually 90% of them heal. 10% will heal with something called vestibular therapy, which is like rehabilitation for the brain. And that's part of the things that we need to do for our patients with concussions. When we're talking about treating a concussion, especially if it's in an adult or someone who's older, we have to really look at the implications of life. When it comes to students, yes, return to school is a big deal. Being away from their friends is a very big deal. But the school system has been prepared and has been catering to these students very well, at least in my experience. The school system is very ready. The athletic trainers are very in tune. Athletic directors, teachers, everybody does the best that they can to reintroduce the athlete student to school gradually and without really putting too much pressure on them as they actually do more and more schoolwork. So they allow them breaks, they give them extra time for test taking, they give them, they sometimes count the old grades instead of taking new ones, so they do a lot of good work with helping the students. When it comes to real life, it's pretty difficult. I can imagine any one of us missing work for a week or two would be a big financial injury, big ego injury, and a big sense of well-being injury, meaning we all like to do what we like to do, and missing out of work doesn't make us feel good. And life doesn't really stop for us like it does for the students. So it's very important for us to keep that in mind as well. It's really important to get the adult concussion patient back into work as safely and as fast as possible. And that has implications. You have to have people who are able to accept some modifications to their job, like light duty or something like that, but you also have to have employers who are able to do that. So that does get tricky. That does still remain to be the goal, which is get the patient better, get the patient back in work as fast as possible and as safe as possible. We end up using quite a bit of more people when it comes to treating people with concussion when they're adults. That does include vestibular therapists for sure. Sometimes we need speech therapists and cognitive therapists. Sometimes we need to see ophthalmologists, optometrists. As I learn more and more, as I see this more older population of concussions, I'm actually learning that I really, really need to get more psychologists and psychiatrists and therapists actually involved, because it is a big hit. And like I said, these are usually associated with a relatively major injury, like a car accident or a work injury. So something like PTSD can actually be a real issue to deal with. Neurologists are always involved due to headaches and migraine headaches and other types of headaches. Sometimes if we have seizures, we also need a lot of people on our team. And that's kind of helpful most of the time. Duration of therapy changes based on the baseline of the patient, based on the needs of the patients, and the nature of the injury. The more intense the injury, the more complicated the situation, the longer the therapy needs. Another point that's really important that I think we don't really know the answer to is the window for improvement. What is the window of healing that we have in a concussion? We know for a fact that the sooner the better. So it's really important to get in with a specialist as fast as possible. 1 month is better than 2 months. 2 months is better than 3 months. The more time has lapsed between the injury or the onset of a concussion and the treatment, the harder and the more difficult it is to actually get to where we need to be. So especially for adults, actually it's not especially for anyone, it's for both, for adults and for kids. It's really important to get in a timely fashion. A week or two is incredible. Anything under a month is excellent, as long as that works with life. So the window for healing is roughly estimated around 2 years. And that doesn't mean that no healing happens after that. It's just that the healing after that is very, very slow. And that usually means that we have to allow the patients to heal on their own at their own pace. So the major interventions that we can do early on, we cannot do them at the 2-year mark. We also like to keep in mind that the goals of healing a concussion are, number one, to heal. So the goal is to heal first and foremost. Then it is to go back to sports and school, to go back to work and all of those things. So a concussion is an injury that as we get older, it does involve more aspects of our life and it does affect more people in our lives. So it's really important to be mindful of that. So it does take teamwork on our part as doctors and therapists and professionals, but it also does take teamwork on the family's part. More so than when we have an athlete or a young student who is injured. If we have any questions at this point, I'm very happy to answer any questions. And if anything needs to be explained further, I'm very happy to do that.
Sure. First, just wanted, you got a few messages. Tina Oliver said, thanks for always taking care of our athletes. And Jen Armstrong said, we're so happy to have Dr. Alcameron as part of our EC Glass medical team.
Thank you, guys. Appreciate it.
All right. So first question: if I get in a car accident with no other injuries, but I feel like I may have a concussion, what should I do first?
So thank you, that's a great question. It all depends on when did the accident happen. If we are concerned about something within the first 24 hours, it's really important to get in with a primary care doctor or to get in possibly in the emergency room if we have any of the warning signs that we talked about. But most of the time, if it's just I feel dizzy, I have a headache, I feel like I'm off, it's very important to rest early on. So the first couple of days, whoever can give you a note, to be quite honest with you, whether it's your primary care doctor to keep you out of work for a couple of days or rest for a couple of days, or if it happens to be a concussion specialist, that's the place to be. If the symptoms last past a week or so, I think it's reasonable for you to be evaluated. It all depends on comorbidities as well. So if we have other issues such as migraine headaches, baseline dizziness, baseline issues as far as car sickness or motion sickness or anxiety or depression, then it becomes more important to be evaluated by a concussion specialist. So the short answer is rest initially. The second answer is be evaluated.
There's a similar question, but it was specific to children. So if you suspect your child has a concussion, does anything need to be done differently? Go to the emergency room or kind of follow the same protocols?
So children's are a little bit more tricky because children's can't really give us the symptoms. When we say, hey, does your head hurt? If it's a child 8 years and younger, almost always they're going to say yes. That age group really wants to please the parent and they want to answer yes to any adult. So if there are no warning signs, the kid is not unconscious, doesn't have a big gash, doesn't have a big bruise or hematoma, it's really reasonable for us to have that child on what we call neurocheck. So we check on them when they're asleep next to us or in the bed, and we check on them every 2 to 4 hours. We just wake them up, we talk to them and let them go back to sleep for the first 24 hours. And that's just in an effort to rule out a subdural hematoma. But if we are by any means concerned about a child, I always recommend getting evaluated by the emergency room. Adults, yes, absolutely, I think, or the pediatrician. Kids, either the pediatrician or the emergency room. Adults, primary care doctor is perfectly acceptable.
Someone asked if you can talk more about home care following a concussion.
So that has quite a few different scenarios. So if we're talking about a child, definitely we want to, like we said, limit, not take away all electronics, limit any activity that can have any kind of dangerous events such as climbing a tree, bike riding, trampolines, roughhousing, that sort of thing. We also want to make sure that we allow them the chance to sleep as much as they need to. We allow them the chance of quiet as much as possible. If they want to just relax and rest for a couple of days, that's a very reasonable thing. If we feel that they are able to do more and they want to do more, we should allow them to do that. We definitely need to make sure that they are improving rather than not improving. If it's an adult, it's a little bit challenging because adults are usually in denial most of the time when a concussion happens. So they end up forcing themselves initially. So family members have to really kind of tackle that very gently and basically try to convince them to take it easy or to get evaluated. As far as other things, to basically keep them as comfortable as they need to be, as rested as they need to be, least stimulation is better.
All right. Can a concussion 20 years ago be the basis for migraines now?
So that's actually a great question, and I'd be lying if I tell you we know for a fact. But we know for a fact that someone with family history of migraines, if they get a concussion, that can precipitate migraines. So there could be some genetic predisposition initially. It is also possible that someone with migraine headaches that were very, very minimal ends up with a concussion, and then after that they become significant. We don't know for a fact that someone with absolutely no history of migraines or family history of migraines could get migraine due to a concussion. But it is very likely that we all have a little bit of genetic disposition to it. So the answer is yes, it is likely. Can we say it's a direct cause and effect? I think that's impossible at this point with the research that we have.
All right. Someone asked, explain more about the 2-year window healing?
Excellent. So this is something that we didn't get from concussion literature. We got this from traumatic brain injury literature. So strokes, bleeding, post-surgery, tumors in the brain. We know for a fact that neurologically people can improve up to 2 years. What does that mean? If we want to rehab someone, if we want to rehabilitate someone, if we want to work with someone aggressively on physical therapy, there's an amount of effort that's involved from the patient, and there's an amount of reward that the patient gets. As we are more removed from the actual onset of the injury, the effort will stay high, but the return will be minimal. So when we get to that 2-year mark, usually being in a structured environment such as physical therapy is really not going to have a major yield. So being out there in the real world on your own might still give you a little bit of benefit, but it's not, the cost benefit is not physically there for us to say to someone, continue with therapy past the 2-year mark. So it's not the end of improvement, but that's usually the window where we can make the most impact with structured therapy.
So there was a question specific to vestibular therapy and just asking to explain that a little bit more, and also who provides that type of therapy.
So there's quite a few places that provide vestibular therapy. We provide it here in our office in Lynchburg, in our office in Forest. There's a couple other places that actually provide it in town. There's a place in Rustburg. It is becoming more and more mainstream. There are more people who are aware of it, and there are more people who are practicing it. Vestibular therapy initially is therapy for the vestibular system. The vestibular system is the balance system of the brain. It would have been great to have a vestibular therapist here. They would have probably been able to tell you way better than I could. But what ends up happening is we all have, as we get older, our systems are not as great as they usually are. One of the things that can happen is dizziness, or if we have dizziness with a sense of spinning, we call that vertigo. Everybody has heard of someone, hey, my crystals are out, I need to get my crystals repositioned or adjusted. That's how vestibular therapy initially started. It is therapy for the balance of people, and it initially was kind of an old person disease. But as we learn more and more, we actually figure out that that's happening in our younger population. Vestibular therapy is therapy for the balance system, and it's an exhaustive kind of therapy. When we do it for a concussion, we don't do purely vestibular therapy. We actually incorporate many other things in it. We incorporate a little bit of physical therapy, so there's going to be a little bit of exercise. We incorporate a little bit of cognitive therapy, so there's going to be a little bit of memory tricks and mind games. But vestibular therapy in its pure essence is training for the eyes. For example, you sit and you're shoulder distance apart from a board and you look right and left with your eyes. You go up and down with your eyes. You stand on what we call a Bosu ball, which is pretty much like something that makes you uneven. You stand on one leg and you do those exercises. You fixate on an object and you look right and left. Multiple other things, you walk around and you basically look to your right hand and your left hand holding cards. It is significant stimulation of the balance system of your body, and what we try to do with vestibular therapy is push the envelope. So what does that mean? Just like if you're trying to train for a marathon, for example, and you start running and now you can run 5 miles and you feel awful. If you stop, you're only going to be able to run the 5 miles. If you keep on going, now you can run 6 and 7 miles and you still feel awful, but the 5 miles became easy. So it's really important to remember that it is a training. So every time you go to vestibular therapy, we're gonna basically saturate your system with a significant amount of work. So you're gonna leave us feeling tired, dizzy, you might even want to throw up. But the whole idea is every time we see you, we push harder and harder and we take you one step further so that the normal activities that you do don't cause you any symptoms.
Someone said 3 weeks ago I fell and got a concussion. I seem to be getting worse. Emotions are all over the place, crying and confusion. Do I need to be seen again?
Being seen is 100% at your discretion, but I absolutely think that it's very reasonable for you to be evaluated, yes.
If diagnosed with a mild TBI due to a concussion by a neurologist, does it heal or go away with time?
So it does heal in the majority of symptoms. It does heal, but it does take time. And like we said before, depending on how old we are. So 12-year-old concussion is different from an 18-year-old concussion, is different from a 45-year-old concussion. So obviously 12 and 18 are the best age groups to be in, and 90% of the time those people heal it completely. It does take weeks though. It could take days, but it's usually a minimum of a week. If we are in the older group, so I'm over 30, if we're over 30 and it's been a week or two and we haven't made a recovery, at that point it makes perfect sense to be evaluated, because it could mean that we need something a little bit more.
Would someone be sensitive to light after a concussion?
Excellent. So I did not mention that as a symptom, but yes, that's one of the things that we actually use as pathognomonic, meaning it's one of those kind of red flags that make us think: sensitivity to noise and sensitivity to light. Quite often my patients take the test in our exam rooms with the lights turned off, and quite often people walk in with dark sunglasses, and I've had very often to give kids actually notes to take to their teachers to allow them to wear sunglasses, but that does resolve once the concussion resolves.
Can you explain further the post-concussion syndrome?
Excellent. So post-concussion syndrome is a not well-defined syndrome. It is a syndrome that actually occurs after we have sustained a concussion. We sustain a concussion, and then within the acute phase we call it a concussion. When we get to the chronic phase, which is 3 to 6 months, we start calling it a post-concussive syndrome. We know for a fact that an injury had happened within the past few months. We know for a fact that that injury had caused symptoms and some sort of disruption of life. However, when we have post-concussive syndrome, we are no longer just dealing with a pure concussion injury. Almost always there are other factors that are playing into it, and most of those factors are mostly psychological. So someone who has sustained a concussion has had some disruptions to their lives, and that has caused significant stress / strain / PTSD, depending on the nature of the situation. Those are the patients that are slightly challenging, which is good. We always like challenging, but not for the patient's sake, for a doctor's sake. But challenging is pretty much the word to describe these patients, because that's when the multi-team approach happens. Quite often patients end up seeing multiple different providers, multiple different doctors. They end up getting new glasses because their prescriptions are not working. If they had a little bit of depression, the depression is worse and the medications are upped. If they had a little bit of ADD, that's worse and the medications are changed. And there's some disruption of relationships, some disruptions of within the work environment, and significant disruption of personal, mental, and emotional health, as well as just a general sense of not feeling good. And those are cases that we actually can help. We can help them quite often, and quite often there's a very measurable and very noticeable effect on their lives. But that's the challenge that usually requires a team.
A few questions related to having multiple concussions and how that changes the treatment. So this one specifically said, I've had multiple concussions over a period of 6 years from normal everyday activities and have plateaued with healing. Is there anything that is helpful at this point, and how do multiple concussions change treatment options when you haven't healed from the first one?
So that's an excellent question. That's a very common question. So it all depends on where we are now. How functional are we? What level of impairment we have? Multiple concussions are a complicating factor. That means that they do make the treatment for concussions more challenging. They do make the recovery usually take longer, and it makes it a little bit more disruptive of life. Now, the question that we all know and we've always known for a very long time was that yes, no concussion is absolutely free. Every concussion that we get does affect us in somehow, and there is a cumulative effect of concussions. However, quite often when we have people who have never been addressed or investigated fully, sometimes we have one concussion on top of an unhealed concussion, and it is very likely that people's symptoms can be addressed. So someone who has significant vestibular dysfunction, so dizziness, lightheadedness, poor vision, we can address that with vestibular therapy. Someone who has predominantly emotional, psychological issues, we can address that with psychotherapy and psychologists. Someone who has physical issues like neck pain, migraines, we can do medications. We can also do Botox injections sometimes. So if we have truly had 6 concussions and have not made a recovery from, we've made a recovery as much as possible from the first, second, third, and fourth, and then now after the 6th, for example, we are having symptoms, we end up with a slightly different approach, which is I want to fix the symptoms as much as I can so that I can actually realize what is something that's going to last for a long period of time, what is something that's going to be a new norm, and what is something that we can overcome. Quite often the picture is muddied from one concussion on top of the other. So those are definitely more challenging, and at the same time those actually do take longer to heal. But there's almost always something that can be done for them.
I know we touched on this a little bit earlier, but there was a question for a little bit more information about the ability of a child or adolescent to heal from a concussion versus older adults.
Excellent. So if we're talking about the age of 15 as a cutoff, so 15 to 6, for example, so 6 years to a 15-year-old, we know for a fact that their brain is still growing versus my brain, for example, so they still require more and more energy on a day-to-day basis. So we know that those people, when we have a concussion, they actually require energy to fix the problem that they have. So they need to heal the brain physiology by themselves, and that does take energy. Their baseline energy needs are higher than the 15 to 18 or the 15 to 30. So on a day-to-day basis, they need more energy. When they get a concussion, those energy requirements are even further. So when we have a higher baseline plus higher energy needed, they end up needing a longer time to heal a concussion. We know for a fact that 90% of those age groups heal within the period of 3 to 4 weeks. I even sometimes wait with the younger patients 5 weeks. And when those younger patients heal, great, wonderful, everything is excellent. If they are part of the 10% that don't heal, we end up fixing them. And when we fix them, we're talking about vestibular therapy. And we know for a fact that we can get them 100% success for the first and for the second concussion that needs vestibular therapy. The third concussion, the rate is not 100%. So what we really want to achieve is we want to make sure that we allow them to heal as much as they can on their own and get them to full recovery. But yes, a 15-year-old and younger is going to need 3 to 4 weeks. An 18-year-old and older is going to need roughly 2 to 3 weeks. The chances are equal in them of 90% healing spontaneously and 10% needing vestibular therapy.
You've gotten multiple words of encouragement from, let's see, we've got messages from Lindsay Francis, Sarah Cruz, Whitney Radijak sent a message thanking you for doing this.
Thank you.
And Amanda Smithson as well.
Thank you guys. Appreciate it.
All right, so we've got another question about a child that plays travel soccer. I've seen the other players wear headgear. How effective is headgear, and should I get one for my daughter?
So there is no science whatsoever that any of the soccer headgear helps. The only headgear that we have that we know works is the rugby helmet that goalkeepers sometimes use, and that is to prevent fractures of the skull. But the concussion bands, the concussion headgear doesn't really help, and this is not proven, but we as doctors think that that kind of makes those athletes a little bit more of a target. So if I know that someone's wearing it, I know that they probably will not challenge as hard, so I might use my elbow a little bit more, I might jump a little bit higher. So there is no scientific evidence that says that any of that headgear helps prevent a concussion or ameliorate the effects of a concussion.
I have a son that plays lots of sports. In your opinion, which sport is best, meaning less opportunity for a concussion?
So that's a very common question, and that's a very difficult question to answer because, like we said, 50% of concussions are not sports related. To be quite honest, People have asked me if I would let my kids play football, and the right answer and the real answer, it happens to be the right one, is that yes, if they want to play any sport, as long as they actually are committed to it and they want to practice and they want to play it, I am 100% in support of every child playing the sport that they love. I do not believe that the risk of concussions is enough for me to hold my kids out of any sport. Now, if that was the fourth concussion that a child was having, then that's a very difficult and different conversation. At that point, yes, we have to look at risk stratification. But if, knock on wood, he hasn't had any concussions and he's a great athlete and he enjoys all of them, I personally wouldn't restrict him. But if you really need an answer, it's basically either track or cross country or swimming. But I'm not going to trick you. I'm going to actually be very honest. I've had swimming concussions, and I've had swimming related concussions, I've had cross country related concussions, I've had track related concussions. So if it's going to happen, it's going to happen. Otherwise, I just let him play and have fun.
Someone mentioned that they've had hearing impairment since their concussion. Sounds are really loud and hurting their head. Can you just speak a little bit about maybe the options for that or recovery period for that?
So we know for a fact that with concussions, hearing issues can arise. Ringing in the ears, tinnitus, is something that's very common, but almost 90 to 95% of the time resolves within a year. The issue we have is as we get older, we end up with multiple other normal changes or pathologies that happen within the ear, and it is very important, if we are an adult, meaning we're not a 15 or a 20-year-old, and we still have that issue, to get our hearing assessed and to have a full ENT evaluation. Multiple things can happen, and I definitely would recommend seeing an ENT to make sure that there's no hearing injury that could have happened.
My parents are getting older and I can't be with them all the time. Sometimes they don't like to tell me if something happens, like a fall. What signs should I look for to know if they might have had a concussion?
So most of the time, if we are talking about parents, it's confusion. That's the thing that really triggers people. So if you're having a conversation with a parent and they're asking the same question again multiple times, especially if they haven't done that in the past. If they were able to make a grocery list and go to the grocery store and get it, and they're not able to do that anymore. They're misplacing things, they're losing things. You end up having to do more things for them. They end up not being able to give you a story of what happened, memory loss. All of those things are very important to keep in mind. The tricky part of that is, as we get older, dementia can happen, and that becomes a very tricky situation. If I know for a fact that they were 100% lucid on Monday and then we woke up on Tuesday and they're confused, we definitely have to rule out the dangerous things such as strokes, falls for sure, any other things. Medications end up playing a big role in confusion. But if we have cleared everything out and there's still some confusion left, some inability to remember, some light sensitivity, similar symptoms to what we have, it's important to kind of at least ask the question.
Can you touch a little bit more on how you know when it's safe for your child to return to play after a concussion?
So I absolutely believe that that is something that should be decided by a professional, whether it's the primary care doctor, pediatrician, or a concussion specialist, for multiple reasons. Because like we said, for us to diagnose a concussion, it's not just one thing, it's a battery of things. It's symptoms, it's examination, it's neurocognitive testing and computer testing. That would be the same case with return to sport or return to learn. Also, as a parent, I personally wouldn't want to have the responsibility of clearing my child and then discovering that they were not 100% back to normal. Athletic trainers as well, they can all be part of the team, but I don't think it's a parent decision.
Right, and our last question, unless any more come in while you're talking about this, is about the impact test. Can you talk a little bit about how the impact test specifically works and if that's something we do here?
Excellent. So we do use the impact test. We've had multiple iterations, we've had multiple things out there, and I'm by no means endorsing impact, even though I do use it, and it is one of the things that we use here. It is the thing that we use here, but it is the most studied and the most validated test that I know of. It is FDA approved. It is a computer testing where we actually test the patient's ability to remember. When we're talking about remembering, we're talking about memory for shapes, memory for numbers, memory for letters, and we test their speed and ability to do that. So what we're trying to test is, can you recognize the information? Can you process the information? Can you hold on to the information and remember it? Can you reproduce the information even though we're testing you with multiple different things? And at the same time, we're testing how fast you can do this, and we're testing your reaction time. It is meant to detect any kind of disability as far as the patient's process of thinking and memory and recollection is concerned. It is there to test for defects. It is only approved purpose is to diagnose a concussion. So basically, it is a tool that we use in addition to the other tools that we have that test for the cognition of the person. We can examine physically the vestibular system, we can check the eyes, we can check the balance, we can check the neurologic system from all its perspectives, we can talk about the psychological situation, we talk about the emotions of the patient, but when it comes to testing their memory or their ability to remember, think, and process, that's the test that we take. It takes around 20 to 25 minutes depending on how fast you are. It's done on a computer with a mouse, and basically we do have, all the city schools actually do have baselines for their contact sports athletes, which are very helpful, but they're not always necessary, but they're helpful to have. So if we have, this is where we were, this is where we are today, that tells us quite a bit. However, sometimes we just see the person and we take the first test in the office and we figure out, oh, okay, so this is where we are and this is where we are after we've healed, and now you're good to go. So it's a very useful tool, and it's a pretty quick test.
All right, so that was our last question, so you can wrap it up.
Excellent. Thank you so much. I hope that this was useful, and please feel free to share it with whoever you think needs to see it. Thank you so much for trusting us.
And we just wanted to let everyone know that this will be posted on our timeline afterwards, so you can go back to watch it and hear any of this information and share it with your friends if you'd like to. And thank you.
Thank you.